Hi, my name is Robert Guttmann, and I'm a professor of economics at Hofstra University in New York. I'm also professeur émérite, that means emeritus professor, at the Université Sorbonne Paris Nord in Paris, France, from where I retired last year. I have done a lot of research in my life on the long-term evolutionary tendencies of capitalism, movements in long waves, and also business cycles, but the turning points in those long waves are typically marked by structural crises. And so I would like to talk to you about the current pandemic as such a structural crisis. I have prepared some slides for you that I would like to share with you, and I'm going to do that right now. So here I'm introducing this topic, and the first thing that I want to emphasize in this context is the fact that in the mainstream economists, for example, tend to mischaracterize the pandemic. Part of this problem is about problem of specialization. It's often seen just as a major public health challenge. And the public health officials then don't really focus enough on the economic side of this. So it's difficult to see the whole thing together. But there's also a bias towards looking at the pandemic as something like an exogenous shock. And in reality, it is both simultaneously demand and supply shock, in the sense that it disrupted both at the same time, and it seemed to have come from the outside suddenly, hitting the world. One also needs to emphasize here that economists, mainstream economists, have a framework of equilibrium, of balance. That means also they're looking at capitalism as an automatically self-balancing system from which any disruption to that process is seen as coming from the outside. So there's a framework of thinking in terms of exogenous shock. But in reality, it's wrong in the sense that, first of all, the pandemic itself is endogenous. It's been created from within capitalism, from within the contradictions, in particular the contradictions of environmental degradation. If you think about it, we've had 5 near misses in terms of viruses that could have become pandemics in the last 2 decades. I'm talking here about the severe acute, the SARS, respiratory syndrome, then the Middle East respiratory syndrome. I'm talking also about the bird flu, Ebola, and the Zika virus. Each one of those could have become a global pandemic, and each one of them was within the last 2 decades. So we got to figure out that pandemics are becoming a way of life. They become a recurrent threat, and we were finally hit with one, in January 2020. And this has to do with structural things that have been building up in the capitalist system in terms of environmental degradation, right? In terms of shrinking the habitat of wildlife, having more wildlife commerce, closer interactions between animals and humans, not least also because of increased meat consumption, and so forth. So we've created conditions for pandemics that are from within the capitalist system, and then it's the propagation of any such virus through urbanization and through globalization, of which global travel is part of, right? So there's a clear threat here, a recurrent threat. This is not going to be the last pandemic. In addition, it's also important to understand that the implied notion from the viewpoint of exogenous shock is that once the threat is past, we're going to have a rapid recovery. So there's this fantasy of a V-shaped recovery, which implies a rapid return to where we had been before the pandemic, return to the status quo ante. But in reality, the pandemic is going to last a lot longer. It's going to do a lot more economic damage, and we will also find it a transformative event. We will never return to where we were before. To you about later. So we therefore have to think of this as an endogenous event and from within the structure of capitalism, and a transformative event. And when you think of these elements, then you realize this is a structural crisis, right? And when you think about structural crisis, I mean, the first aspect is that it has a profound impact of change, right? So immediately when the pandemic hit, we had to face a whole new situation where we a stress test to society on all levels, right? And the quality of governance, the public health system, our cultural priorities and preferences, the degree of solidarity between people, all of this was immediately stress tested. And the stress test basically takes the concrete form of having to manage different balancing acts at the same time, 4 intertwined balancing acts. So just getting through the pandemic is a really very, very complex and challenging process. This process also changes the way the system works, right? So in that sense, it's transformative. It accelerates trends that had already been building up. It creates shifts, sudden changes in behavior, and it also destroys things we took for granted. So we have ruptures, right? And then we need to get out of this. And in order to get out of this is the third aspect of a structural crisis. We have to basically rebuild, right? Because there's so much damage that was caused by this process. And rebuilding in order to build back better, we will have to also make some fundamental changes in policy. So there's a prospect of reforms. So let's talk about the first dimension of the structural crisis, which is the immediate challenge, the immediate challenge of intertwined balancing acts, right? And when you think about this, so when the virus is very tricky because it spreads easily, and most of the time it spreads without us knowing it, because it spreads mostly from asymptomatic as well as pre-symptomatic actors, and when it spreads and infects people, many of them have fairly mild symptoms or are even asymptomatic. But let's say 15 to 20% of those infected are going to get seriously ill, and they're going to get seriously ill in a variety of ways. And a certain fraction of those, perhaps a quarter, are possibly dying from it, right? So it is a fairly deadly disease, even though the number of people as a percentage is relatively small. And these characteristics mean that we have to not only change behavior right away, we have to wear masks, and we have to keep social distance, and we have to wash our hands currently because the hands are the most important mechanism of transmission. But we also have to build a testing infrastructure and a contact tracing infrastructure. And so we have a huge immediate challenge trying to live with this virus and face it. And the key thing here is to slow it down, to slow down the spread, right? We call this flattening the curve. But flattening the curve, the primary purpose of that is to basically slow it down so that our healthcare system can absorb those people that are getting sick from it, while also taking care of all the other ailments in the population, right? So we don't want to overwhelm our healthcare system. And so we need to slow down the spread, right? But in doing that, we're taking very restrictive measures all the way to a national lockdown, which happened at the beginning of the pandemic, when we also didn't know much about it, and there was radical uncertainty, and we wanted to play it safe. So, as you well know, in a period of 6 weeks, from the second week of March all the way to the end of April, over 100 countries locked down, and 3.9 billion people, that's more than half the world's populations, were obliged to stay home and stop basically going out, right? And so this is an incredible impact, right? Unprecedented, really. And then that means the economy is put into a voluntary coma, right? And so then you have the challenge of flattening the second curve. The second curve is kind of a deflationary spiral in the economy when you just suddenly lock it down, and because of the interdependence of cash flows, right? And so this becomes an existential challenge for many people and for many businesses right away. And so then the government has to take extraordinary measures of macroeconomic stabilization policy, fiscal policy on the one side through the budget, as well as monetary policy, injecting liquidity into the cash flow system through the financial institutions. And there's also a kind of a balancing act between fiscal policy and monetary policy at the same time. But these are extraordinary measures that have to be taken by the government in order to keep people alive while they're locked down, businesses afloat while they're shut down. And then when you start reopening, you have to have another balancing act of how fast and how far you go in your reopening, while you allow businesses to adjust, to operate at a much lower capacity level, because we still have to maintain social distancing and tracing and so forth. So the businesses cannot return to normal while the pandemic is still among us. And so they have to change their operations, if at all able to open. Right? So this is an incredibly complex, simultaneous balancing act so that we can flatten both curves, the public health curve, that means the spread of the virus and building up the capacity of the healthcare system, while we're also taking restrictive measures that oblige us to operate at less than normal capacity and take the precautions so as to have basically a reopening that doesn't kill us. And so this is an incredibly complex situation. And from, we can kind of qualify this, if you want to give the structural crisis a good name, we can call this the Great Interruption, right? So we've had the Great Depression in the 1930s, we had the Great Recession in 2007, 8, 9, 10, and now we have the Great Interruption, right? And this is a very accurate and apt characterization. Right? But what's going on with this is fundamental changes, as is typical in a structural crisis. You have a simultaneous acceleration of trends, shift factors, and ruptures, all operating together. And just to give you some sort of concrete idea, first of all, your public healthcare system your public health system, which is broader than healthcare because it also has prevention in it, is going to be incredibly stressed and also gets damaged in the process, right? You're running out of capacity, you're running out of healthcare workers that are either getting sick or they're getting traumatized. So you're going to have to rebuild this, and you have to kind of live with the fact that it's going to be stressed, it's going to be pushed beyond capacity, especially in places where the pandemic is not well contained, like in the United States. At the same time, you have another acceleration of a trend, which is the speed up of the digital economy, right? So the internet becomes more important because many of us are working from home. We have meetings now on Zoom or Microsoft Teams. We are ordering online to get products, from daily food deliveries all the way to fancy to cars or whatever. So there's an incredible acceleration of the digital economy, e-commerce, teleworking, and all that. And this means that the key companies of the internet are becoming bigger than ever. They're already huge, and they're kind of a different type of conglomerate than the traditional industrial or even service conglomerates. So these are the 21st century companies, and they have a hugely important role in our economy and a lot of power. They create a value in terms of data, and so there is this whole idea of valorizing and evaluating big data. And this requires regulations, and there are different approaches in terms of regulatory frameworks. In China, it's different than in Europe. In Europe, it's different than in the US. So we also have a more sharply differentiated set of varieties of capitalism emerging around the internet. And then all of this leads us to the possibility of a quantitative leap in automation, which will be driven by the fact that the businesses have to live with a lower capacity utilization and higher fixed costs than before. And so there's technology being built that allows much greater levels of automation than before, from nanotechnology to the 5G infrastructure for the internet and so forth, right? All of this then leads to fairly dramatic changes in the intersectoral matrix of an economy, right? So we have certain sectors are rising, certain sectors are declining, right? You also have, through this pandemic, the death of many small businesses. For example, where I live in New York City, it's pretty obvious already that half of the restaurants will not reopen. They're dead, they're done. And this creates, of course, the prospect of yet further increases in both concentration and centralization of capital, both productive and financial capital, while at the same time you have a more sharper division within the world of work, within the labor market. So you have accentuated labor market segmentation, because you have, through the pandemic, about 1/3 of workers that are privileged. They're basically highly qualified, highly trained professional service workers, whether they're doctors, accountants, financial analysts, or teachers like me. They can work online, right? They can do teleworking. They basically maintain their jobs, keep their jobs, while you have another group of workers who are there essentially to keep the economy going, keep the society going, whether it's cleaning, whether it's working in grocery stores, whether it's police, whether it's the healthcare workers in the hospitals. These we call now essential workers, but they're pretty low paid. Maybe there's going to be a reevaluation in terms of how crucially, strategically important they are, and how much they had to bear the risk of infection from going to work every day, often in public transport, and often at work, being exposed disproportionately to the virus while not being paid a lot and having to go to work. And then there's a third group of workers that basically are in danger of losing their jobs, and if not losing their jobs, of being underemployed, having a lot less work than before. And this may be workers in the gig economy, this may be part-time workers, mostly young people, right? So there's also intergenerationally a brutally different impact, hitting and hurting young people the most. And among the essential workers in many countries, they are very often recent immigrants and other vulnerable demographic groups. So there is the labor market segmentation then ties into another trend, which has been a trend towards greater and greater inequality. And now you have new sources of inequality. You have unequal access to healthcare. You have unequal access to education when most of the education work moves online, right? Distance learning. And then you have also the central bank with its monetary policy pumping huge amounts of liquidity into the financial system, which helps those who have financial income, like earning interest as creditors or earning dividends as shareholders, to sustain their income. And that's another engine of greater inequality. Finally, in terms of the third aspect of structural crisis has to be accompanied with greater financial instability. That's a key hallmark characteristic of structural crisis. And while the banks entered the pandemic period, early 2020, in better shape than they had before, clearly in better shape than the crisis of 2007, 8, 9, they have more capital cushions, more liquidity cushions. All of these are being eroded by the pandemic, forcing actors into far higher debt levels, while at the same time depriving them of income and therefore making debt servicing more difficult, right? So we're ending up with more debt and less income generation for debt servicing charges. Right now, it's not so much of a problem yet because interest rates are incredibly low, if not altogether at zero. But this is not going to last, and the debt is going to be there. So you're going to expect a lot of defaults and loan defaults, and that will erode the capital base of banks, and that will weaken the financial system, while you also can assume recurrent bouts of financial market volatility as we had at the very beginning of the crisis. Right now, many of the financial markets are jacked up by the monetary policy, extraordinary monetary policy measures of the central bank. But you already have also great volatility in currency, in exchange rates, so the currency markets are unstable. So financial market volatility is going to be recurrently there. It's just switching from one type of market to another. And then, most importantly, in my view, is the fact that the pandemic has very much disrupted the intertwined nature of countries within the world economy, right? In the sense that trade volumes have sharply decreased, capital outflow from countries in the periphery back to the center. You have collapsing commodity prices, so exporters of commodities are really badly hurt. You have a sudden stop in the flows of remittances of migrants having gone to rich countries, sending their money back home. So you have a massive disruption of the normal transactions between countries that make up the world economy, much to the disadvantage of many emerging market economies and or lower income developing countries, many of whom are now facing very, very deep problems in their balance of payments deficits and being cut off from capital and inflows. And so it's remarkable, but not surprising, that within 6 weeks, 90 of those countries have already asked the International Monetary Fund for assistance. The International Monetary Fund is supposed to serve as a international lender of the last resort. And this is clearly going to stress the IMF. In the previous crisis, 2008 or 9, in 2009, we boosted the capacity of the IMF, but there are such political divisions right now between the US, China, and the European Union that it's unlikely that we're going to be able to kind of beef up the capacity of the international lender of the last resort. And therefore, there's this kind of global debt and currency crisis brewing, right? All of this means that we cannot return just to the status quo ante. The new normal, once we get out of the pandemic, is going to be very different, right? And we're going to get out of the pandemic slowly, only either by a vaccine or by herd immunity. It's pretty clear to me, especially since it's the second structural crisis in short order, after the Great Recession of a decade ago, that we are facing the end of an era, which we could characterize as finance-led capitalism with a neoliberal policy regime, right? It's not clear what will replace it. We can go either to the right or to the left, or in different countries, either one or the other. But we're going to have to figure out certain reforms. We're going to have to reform our healthcare system, which was going to be so badly damaged by the pandemic. And then we have to rethink our tax system, not least also to deal with the greater inequality and have some kind of element of redistribution through taxes. Our corporations will need to get a different mindset of governance. There may be a need for governments steering these dramatic changes in the intersectoral balance of the matrix, by helping either restructure declining industries or boost rising industries. And above all, you're going to have to find new ways to restructure debt on a fairly massive scale to get out of the financial crisis aspect of this problem, right? All of which can lead us to the final conclusion that there is a possible path forward around accelerating what needs to be accelerated, which is the transition to a low or zero carbon economy. And that is a kind of a program that we can globally engage in, and that we need to engage in because we have another environmental degradation crisis on the horizon, which is climate change. And so the pandemic could be useful as a structural crisis, making us more conscious about the consequences of environmental degradation, and of which climate change is the essential key core problem. And also reminding us that we're capable of tremendous and rapid changes in our behavior if we are forced to, as we have shown with this pandemic, right? So there are ideas, different ideas in China, different ideas in the European Union, different ideas among the left in the US around the so-called Green New Deal. And each one of those is a valid path forward into a different type of capitalism. So I'm done here. I'm going to stop sharing, and then I'm going to just say goodbye to you. Thank you for listening. I hope this was helpful.